In today's practice, we are working on a joint movement that powers all forward motion, walking, running, and going from seated up to standing. We're talking about hip extension. Hip extension is when your thigh is moving back behind you. It's powered by your glutes and hamstrings and can be limited by tension in the hip flexors and quadriceps. We're going to address two muscle groups today, the glutes and the quads, and we're going to be using a lacrosse ball and a foam roller, so have those handy. But first, we just need a little bit of floor space because we're going to assess our current range of motion. When you're ready, come on down onto the floor. We're going to lay face down. We're stacking our hands like so, and you can set either your chin or your forehead onto the backs of the hands, whichever is more comfortable for you. Just make sure you repeat it the exact same way when we reassess our range of motion. From here, we're going to bend one knee to 90 degrees and then just begin lifting and lowering that knee and thigh off the floor in whatever feels like the most normal and natural range of motion without forcing it. As you lift and lower your thigh, consider how high off the floor you can get, how heavy your leg feels, and what's limiting you from going a little higher. So if you push into that little resistance barrier, what do you feel? Does it feel like fatigue in your hamstring? Does it feel like the hamstring's cramping? Do you feel pressure in your low back? Or maybe you feel a little tightness and tension in the front of the hip and thigh. Once you have a good idea of how that leg is moving and feeling, lay that leg straight, switch over to the other side, and again, lift and lower through your normal, natural range of motion without forcing it, and consider how heavy your leg feels, how high off the floor you can get, and what's limiting you from going a little further up. Pressure in your low back, fatigue or cramping, tension or tightness. Good. Once you feel like you've got a good idea of how your thighs are moving and feeling, you can ease out of that. And we're going to start by grabbing our lacrosse ball and we're going to flip onto our backs. And we're going to work on our glutes. So again, the glute is the butt muscle. We're going to cross our right ankle over our left knee. We're lifting our hips up. We're placing that lacrosse ball under the right glute, right above where your back pocket would be. From here, take a breath or two. Start by relaxing the look on your face, slowing and deepening your breathing pattern. Think diaphragmatic breathing or belly breathing if you know how to do so. And as you relax, let the weight of your hips get heavier on the ball. From here, we're going to start to sweep or shift our hips left and right to try to get that lacrosse ball rolling back and forth across the width of our right glute, or at least across the width of where your back pocket would be. Avoid the tailbone and really focus and emphasize on the muscle belly. Now, as you're going, you may feel some sore spots show up. The whole muscle might feel quite sore if you've never done this before. Most importantly, try not to react by crumpling your face up, tensing, tightening, holding your breath. Despite whatever discomfort shows up, we're going to breathe and relax and try to cultivate this sense of calm. Anytime that ball kind of shifts out on you, if you're wearing athletic attire, it might be a little bit slippery, the ball might move around a bit. Just replace that ball right in that upper glute area and continue to sweep side to side. So as we're going here, we're looking for what we feel is the most sore spot, a hot spot, a sore spot, something that we would call a knot or a trigger point, which is normally a little cluster of scar tissue that forms on our connective tissue, which can bind up the muscle fiber, the connective tissue, and limit our range of motion and disrupt the functionality of the joint. So as we're going side to side, find that one hot spot, that one sore spot, and when you're ready, we're going to park right on that little sore spot. And then just take a slow, deep breath or two. Try to relax on every exhale. Again, relax the look on your face, slow and deepen your breathing pattern, create that sense of calm, and allow the hips to get a little heavier and heavier on the lacrosse ball. And if that feels intense enough, we're going to max out at a moderate level intensity. Anything more aggressive than that, you're going to find yourself scrunching your face, holding your breath, creating tension in the body. The idea here is to release, relax, try to soften and loosen the muscle we're working on, and really just let go, breathe, relax. So feel that ball compressing into the muscle belly. And if that feels intense enough, just hold here and try to breathe and relax as best you can. If you want to go a little deeper, very slowly, we're going to uncross that right ankle and we're going to set the foot on the floor next to the left. Keep leaning into your lacrosse ball, don't lose that pressure. And then very slowly, we're going to let the knee drop out to the right and then hinge it back up. Easy does it. Hinge it out, sweep it back up. Breathe your way through it. Relax the look on your face. Those two components, a relaxed look on your face and a slow, deep breathing pattern, help coach your nervous system into relaxing and letting go. It actually down-regulates the sympathetic nervous system, which is your fight or flight stress response, and it helps to upregulate what's known as your parasympathetic nervous system or your relaxation response. Last time, we're going to hinge that knee back up. Very slowly recross your right ankle over your left knee, and we're back to sweeping the hips left and right. Hips are heavy on the ball. We want to feel that lacrosse ball compressing into the muscle like a deep tissue massage-like sensation. As you're going back and forth, despite any discomfort that shows up, remember, we're going to relax. We're going to soften the look on our face. We're going to slow and deepen our breathing pattern. About 5 more trips or so back and forth across this right glute. Good. Then we're going to ease off the ball. We're going to change the cross at our legs. So left ankle crossed over the right knee. We're lifting our hips up and replacing that lacrosse ball under our left glute right above where our back pocket would be. Take a breath or two. Relax. Let the weight of your hips start to rest more and more heavily on that ball. You should feel the ball start to compress into the muscle belly. And then from here, we'll start to sweep or rock the hips left and right. Remember, we're trying to get that lacrosse ball to roll back and forth across the width of our left glute. Again, about the width of our back pocket or so. And as best you can, keep that nice relaxed look on your face. Slow, deep breathing pattern. Think belly breathing or diaphragmatic breathing where your upper abdomen is expanding as you inhale, belly flattens as we exhale. Remember, if that ball slips, just reposition and get right back to that side-to-side motion with your hips. As we're going here, we're still focusing on our breathing pattern. We're relaxing. We're letting the weight of our hips get heavier and heavier on the ball. And then we're going to look for that one specific hot spot. Whatever feels more intense or more sore than anywhere else. Again, that would generally indicate a knot or a trigger point. So we're going to try to park right on that hot spot or sore spot that you found. And again, settle back in, start to breathe and relax, particularly on your exhales. Feel your facial expression softening, relaxing. Any tightness or tension in the neck and shoulders starts to ease up. Hips get a little heavier on the ball. You can feel that lacrosse ball compress a little deeper into the muscle belly. Try to soften and loosen even that muscle fiber that's in contact with the lacrosse ball. Do you feel like you're guarding a little bit, holding some tightness and tension? Try to soften, loosen, relax, release, and let go. From here, if this is enough, stay here. But if you want to go a little deeper, very slowly uncross your legs, place that left foot on the floor next to your right, and then very slowly let that left knee drop out to the left, hinge it back up to meet the right. Move slow and easy. No fast or jerky movements, so everything we do is slow and controlled. 1 or 2 more times, we're going to move that knee out. Remember, we're still leaning into that lacrosse ball. Don't lose that pressure. It's the pressure that really does the magic here. Down and up. Think of the massage therapist when they find a knot, they dig their thumb or knuckle into a muscle. Same concept here. Pressure is what breaks up that scar tissue. So very slowly, we're going to recross the left ankle over the right knee. And we're right back to sweeping the hips left and right. So as we start moving, despite any discomfort, we're going to stay calm, relaxed. We're going to breathe deep. Always cultivating that sense of relaxation. Think cool, calm, and collected. Keep working those hips left and right. Feel that lacrosse ball traveling back and forth across the width of your left glute. Maybe about 5 more trips or so. All right, from here, we're gonna grab our foam roller and we're gonna roll the front of our thighs. So we're laying the foam roller straight across, sideways across our mat. We're gonna come down into a plank pose on our forearms, our elbows. And then from here, we're gonna shift forward and back, just allowing that roller to roll up and down the front of the thighs. So just like we did on the glutes, as we're rolling the quadriceps, the front of the thighs here, we're going to relax the look on our face, slow and deepen our breathing pattern. Now really feel out the front of your thighs. Are you guarding? Are you holding tightness and tension? Try to soften, loosen, release, and relax those muscles. Just feel them start to soften up as the roller digs in a little deeper. So that comes with a little more discomfort. The more we relax, the more we soften and loosen the muscle, the deeper that roller or lacrosse ball that can dig into the muscle. Generally, that's going to come with some extra discomfort, but we're not going to react. We're going to keep that relaxed look on our face, slow, deep breathing pattern, nice and easy. So try to get all the way down near the knee, all the way up by the hips, all up and down in between, and look for that one specific hot spot or sore spot. And then when you're ready, we're going to park right on whatever feels the most intense. We're going to take a slow, deep breath. As you exhale, again, relax the look on your face. Cultivate that sense of calm and relaxation. All right, maintain that relaxed look on your face. Don't scrunch it up as we start to bend and straighten our knees. Just go through that movement like a leg curl, almost like you're trying to touch your heels to your glutes. So as we move through this range of motion, we're manipulating the length, tension, and orientation of the muscle relative to the foam roller. And this movement just helps really break up that tension and tightness. If there is some scar tissue formation on your connective tissue, this helps pull it apart. And again, that will improve our range of motion, our mobility. It also increases our strength and power output. So all those movements I mentioned earlier, walking, running, and going from seated to standing, they just get much more efficient when we improve hip extension. All right, one more time. We're going to bend and straighten the knees. As the knees straighten, we're going to soften and loosen the quads, the front of the thighs. Take a slow, deep breath here. Totally relax on the exhale. And we're going to start to pulse the legs toward and apart from each other. Just a short, quick kind of movement. Should feel like the muscles getting tugged side to side. Just manipulating that muscle. Again, if there is scar tissue forming there, this helps break it up, clear it out, and restore a more healthy and functional movement pattern to our hips. A few more pulses here. Good. And then just roll up and down the front of the thighs about 4 or 5 more times. Excellent. All right, from here, let's ease off the roller and we're going to reassess our hip extension. So we're going to come back down onto our belly. Remember, we're going to do it exactly how we did before. Stack your hands, set your forehead or your chin, however you did it earlier. And then before you actually reassess, think back on those 3 points that we mentioned. How high off the floor did your leg get? How heavy did the leg feel? And what did you feel was limiting you from going a little higher? When you're ready, bend that right knee to 90 degrees, and then lift and lower that thigh off the floor, and just see if it feels a little lighter, a little easier, a little smoother, more fluid. Are you getting up a little higher? Does it feel less restricted? Whatever was stopping you before, has that eased up a bit? And again, when you have a good sense of how to compare the before and after, switch over to the other leg, and again, lift and lower. Consider those same points. How high off the floor are you getting? Any higher? How heavy your leg felt? Does it feel a little lighter? Whatever was stopping you, do you feel like that's moved a little bit? Has it eased up? You find that this movement is lighter, looser, more fluid, more efficient, a little easier to do. All right, so that is hip extension. Again, we only worked on 2 muscles, the glutes and the quadriceps. So stay tuned to future videos. We're gonna really do a 360-degree review on the hips and thighs and to really optimize hip mobility. Thanks so much. We'll see you soon.